for your attention. So if we want to have questions, okay.
A couple of questions from our online audience. The first one, it has been suggested to us to start our daughter on an insulin pump. She is 8.5 years old and was diagnosed about 1 year ago. I'm really nervous because we count carbs to determine insulin and afraid she's too young. Any thoughts?
Well, the insulin pumps are routinely used in kids with type 1 diabetes, and they manage it. I'm not a pediatric endocrinologist, so I don't see those kids, but it's in routine practice to use them in kids that are probably starting around that age, when they can push the buttons themselves. I don't really see any reason not to use it. It's probably easier for her than having to take a shot multiple times a day if she's eating. So I would see no reason why she can't do that as long as everybody learns how to use the pump, and the school is alerted to that. And she should always carry the insulin with her, in case the pump malfunctions. But if the patient's willing to do it, then it's just a delivery system, so it allows you to avoid all those multiple shots.
Another one is, what can we refer or give doctors to inform them about CFRD?
What can we give them? Well, I give them lectures. They know so little about it. I think there should be some, I don't know what works. Public health campaigns don't seem to work in general. So I think as it becomes more recognized by these societies, actually, it will help, because now more articles are being published in diabetes care and some of the major journals. They're talking about it at the endocrine meetings instead of just the CF meetings. And so there's a little bit more generalized awareness. And when they come up with position statements and things, then doctors start to look at that, because they said, oh, there's a standard of care. I need to know what it is. So those are all good things, and I think that will increase the awareness. On a much larger level than me giving a lecture, but they really, the position statement doesn't really educate them about the physiology like we talked about. So that's tough. It is hard, because there aren't that many centers that treat CF diabetes, and the ones that do, I don't think many of them have an endocrinologist. But I think we're moving in the right direction.
I think the first one was answered already.
How to diagnose. Right. Pretty much the same as any other kind of diabetes now. Any other questions? Yes?
I guess there was recently a beta cell line that was finally immortalized. So what would that mean?
Well, I don't know. I think we're a long way from having, some sort of a stem cell transplant, and even the islet transplant seems to have stagnated. The best transplant option for diabetes right now is still a whole organ pancreas transplant. So, there was this nice trajectory of improvement, and I feel like it might be leveling off. I hope that one day we'll be able to transplant stem cells or some, islets. But at this point, we're far from being able to do that. And the patients with CF, I don't really think that their diabetes is severe enough to necessitate that, because they can be easily managed with insulin. The patients, who make absolutely no insulin are much harder to manage, and usually they'll do a transplant in the setting of a kidney transplant as well, and it's really helpful for them. I don't think the CF patients would really need to do it. Okay, anybody else?
I've got one more that just came in.
Okay.
From online. Where can we find the ADA 2010 position statement? Is there an easy way to access it on their website or some other place?
Oh, I haven't looked on the website, but I think if you Google, you could probably just Google it, or you could look on the ADA website. It would be the 2010 position statement on cystic fibrosis related diabetes. You'd have to say that. So, probably even Google, you could find that. Okay. Thank you.
We've been sharing this evening's discussion of cystic fibrosis-related diabetes with Dr. Tracey McLaughlin. Thank you all for joining us. Thank you for joining us online and here today. We have evaluations to fill out. Appreciate if you do that. In addition, if you want to re-access this presentation, you can go to our website and you can let others know about what you've heard tonight. We will be, again, having a CF Discovery Series. It is the second Tuesday evening of each month for the remainder of the year. Many thanks again to AMED and to Genentech for supporting this effort so that we can share this really critical information with you across the miles. Have a very good evening. Thank you.